Well, first of all, there's the question of what are high impact interventions. A lot of people talk about this. It's a term that's thrown around a lot. To some extent, everything that MCSP works on is, in a sense, high impact interventions. We try to help countries to be able to improve the health of their populations and to really implement their own strategic plan. When we say scale up, we mean get the intervention to the large majority of the population that needs them. And specifically, we want to make sure that that's not just done in a way that's not sustainable. We want to make sure that it's done in a way that the country will be able to sustain that after MCSP leaves. And there are certain mechanisms that we really promote for scale up that depend on that idea, or that kind of try to really make sure that countries are keeping in mind that idea, that they're getting frequent information, that they're also really have a management team that is kind of able to kind of get back the information at all levels, national level, subnational level, down all the way to the local level, and make decisions and change plans as needed in a structured way. One thing we found with scale up, in order for it to be effective, there really can't be just a kind of single, what I might call project-oriented plan. Project-oriented plan, when I say that, I mean something that's very structured, that has a presumption that we know everything before we start and we just need to implement that plan. There are going to be unexpected things that happen when we're working at scale in a complex environment. In that case, there needs to be a plan initially, but it also needs to be some mechanism for looking back at that plan on a frequent basis and doing continuous learning. So identifying what those high impact interventions are, what the most promising ones that have already kind of been shown that they're past the innovative stage. We should be working with various other donors, technical agencies at the global level, and then within countries, kind of really working with countries to really help them in some cases to actually finalize their strategic plans or update them, and then once they have them, to really then kind of identify what things are needed to put those in place. And in many cases, it's going to be to scale up things that are not currently part of routine practice. Partnership is really important, not only for MCSP, but specifically for the Ministry of Health. They can't just depend on a single project. It will only get them so far. And making sure that there's a multi-partner environment where people are working together. Some partners might be working on logistics to be able to make sure that all the things are in place that are needed. Others might work on the information system. Other partners help to finance. All these are really important to make sure moving forward that the high impact interventions are actually implemented at scale, and that happens in a sustainable way so that they continue afterwards.